Hi, I am Dr. Anantha Krishna. I am a practicing surgical gastroenterologist at Nano Hospitals, Uttarahalli. So, a hernia is a protrusion of any organ which is inside the body, outside the cavity where it was originally supposed to be located. So, there can be various kinds of hernia. If this hernia occurs in and around the umbilicus, it is called as umbilical hernia. If the hernia occurs in the groin region, it may be called as an inguinal hernia. And if the hernia is occurring in a previously incision area, that means if the patient has underwent a surgery previously and a hernia has occurred in that place, that is called as a incisional hernia. So what are the symptoms of these hernias? So first thing is that the patient will be noticing a bulge in the area of the hernia. This initially can be a reducible bulge. That means if the patient applies a little pressure, this bulge will go off. In the later stages, the bulge will refuse to go in spite of pressure. That is when we call it as a irreducible hernia. So in addition to this bulge, some patients can also experience pain, and in the later stages it can complicate to cause obstruction of the intestines. So that is when the patient will start having vomiting and bloated sensation of the abdomen. So what are the treatment modalities for a hernia? The only possible treatment for a hernia is by surgery. So during the surgery, we will have to reduce whatever has come out back into its original cavity, put it back into its original cavity and repair the defect that had allowed the organ to come out. So we will repair the defect so that this organ will not come out again in the patient's life. So there are various modalities in which we can do. Earlier this used to be done using open surgery techniques, wherein we used to make a small incision over the hernia, reduce the hernia, place stitches and place a mesh. But with recent advances, we can do this surgery using a laparoscopic technique. In laparoscopic technique, the advantage is that we will be making small holes through the abdomen cavity and reduce the hernia, place the mesh from inside the patient's body so that the hernia will not recur for the patient again.